Geetha Gowda. I'm a second-year medical student at Tulane. So my first abstract, we're looking at common dermatologic conditions in athletes. And kind of the purpose behind all of this was to create a guide for sports medicine physicians to have all of these conditions that regularly pop up in athletes in one place with treatment, presentation, all of those things, because a lot of these conditions can be really easily and quickly prevented and treated if recognized early. So that was kind of the purpose behind creating this systematic review that we've been working on at Tulane. So ultimately, we looked at cutaneous manifestations, athletes, sports dermatology, and we're able to narrow it down to 23 conditions. And you can kind of divide these into three main categories: infectious, traumatic, and inflammatory. So infectious, probably, definitely the most common one, divided into parasitic, bacterial, fungal, viral. And then those are obviously due to an organism, microorganism. And then the inflammatory dermatoses are typically the cause or the cause of a causative agent. This gets into things like allergic contact dermatitis, irritant contact dermatitis, urticaria, exercise-induced anaphylaxis, and sun-related skin neoplasms. And then finally, traumatic conditions, any kind of, mechanical irritation that athletes are definitely prone to with different kinds of equipment that they might use, just the physical motion of some of the sports that they engage in, things like that really create some kind of conditions, especially like marathon runners. They sometimes develop things on the back of their heels and stuff. So that's kind of the purpose or background of that one. And then these are just some common pictures that we found of typical presentations of some of them. So I'll just quickly go through a few of them. The first one is kind of the honey colored crust that you see in pitigo. So that can obviously sometimes be seen as like different things. So if you kind of have that clinical suspicion and idea in athletes, you obviously will be able to be treated quicker. And then the second one is just like a furuncle. And it obviously can present differently, but it typically presents as kind of like not completely open ulcer, but closed ulcer with redness and erythema around it. And then pitted keratolysis is actually really common because athletes obviously have to wear socks in a lot of the sports that they use, and then they are like running around sometimes, and that creates a lot of like moisture and heat that bacteria could get into and then actually create physical pits in the foot. So that's that. And then obviously, I think we all know about herpes simplex virus and how that presents, but that's another one that is really important to treat early as well. And then, yeah, all of these results are basically just completed, like I said, to create a guide for sports medicine and surgeons who encounter these dermatoses. And so it's kind of crucial that they have like a little bit of awareness. Obviously, not all sports medicine will go through a full dermatology, fellowship, all those things, but it's important to just have some of these common ones in mind when you're treating and working with athletes, because at the end of the day, the whole point of, treating athletes is to get them back and return to play. So to decrease that time as well. Does anyone have any questions so far? This one.
Is there any actual physical guide or link to
There are like a few guides on like PubMed and stuff, but we're kind of working on, we're not done with it yet, but that's like the purpose of this one. Yeah. College, that's a good question. Honestly, I'm not totally positive on why, but I would imagine that in college, you just like the nature of like competing more and actually having like more practices and stuff, especially for infectious disease, like would just create like more like time for like, more infectious disease to come up, would be like my thought behind that. But in the paper that we were looking at to see kind of the epidemiology of some of these infectious disease, we just found that it the prevalence was really high, obviously, in high school and college sports. Okay. And then I have two more abstracts, but they're both kind of smaller parts of the same paper. So this one is looking at Rhizopus solanifer and its implication in hypersensitivity conditions. So I think a lot of us know rhizopus as kind of the common bread mold, causes mucormycosis, diabetic ketoacidosis, all the buzzwords. But its implication in hypersensitivity disorders has not been fully, I guess, investigated. And so that's kind of what our team is looking at with Dr. Carlson. And it is a mold that is fungus that's included in common aeroallergen sensitization. So we wanted to see if there's any associations with rhinosinusitis, asthma, conjunctivitis, allergic fungal sinusitis, and allergic bronchopulmonary mycosis, or allergic bronchopulmonary aspergillosis. So those were kind of the main search terms that we were using with all the fungi that we were investigating. And so with rhizopus specifically, we included 9 studies, and we did find it is obviously a rare sensitization, but we did find that it should be evaluated when you're working up hypersensitivity disorders that are negative for more common sensitizations. So in this table, there's a couple of case reports and case studies that found that in some populations, there was a sensitization towards rhizopus stolonifer, and they kept working up these patients, and they were negative to a lot of other things, a lot of other common fungi and aeroallergens, and then they ended up being sensitized to rhizopus. And there was like another case study that talked about this, and then additionally, there was one study that found that it was common, or it led to allergic bronchopulmonary aspergillosis. So, and then they were actually negative to aspergillus itself. So kind of just something to keep in mind when working up, hypersensitivity disorders and sensitizations, and they're negative for a lot of other things. That's kind of where we found that rhizopus fits in. And it's not only always going to be like mucormycosis, which is also rare, but yeah. Any questions? Right. And then my last one, very similar background to the rhizopus abstract, but basically looking at a different fungi. This was Arubicidium pullulans. Definitely a very rare fungi, but it is included in, the environmental allergens testing. And it is found in the New Orleans area rarely. But again, the clinical relevance is like not totally understood. So we're trying to figure out how relevant it is and how when it should be used for testing. And so the same kind of systematic review was conducted with this fungi, the same conditions. And with this one, we did find that there was sensitivity to A. pullulans in actually Hurricane Sandy homes, damaged homes. So that came up in about, I think, 3 or 4 of the papers that we looked at. And so ultimately we concluded that it is obviously a very uncommon sensitization, but it should be considered with those Hurricane Sandy homes, we did find greater severity of asthma. And so when considering kind of severe asthma in patients, again, negative for a lot of other workups, in conjunction with some of these environmental risk factors, Arubicidium pullulans should be considered in that review. Any questions?